Hi, I'm Adina Schwartz, and I'm a reproductive endocrinologist for RMA of New Jersey, based in Somerset. I went to University of Maryland, College Park for undergraduate. I went to New Jersey Medical School in Newark, New Jersey. And then I was at NIH, the National Institutes of Health, for fellowship, and now hopefully in New Jersey for good. My parents actually struggled with infertility, and I think that's where my interest in fertility care really came from. They were told that they would never be able to conceive due to fertility issues on both sides, and I was their miracle baby, but it took them many years and many cycles of treatments before they were able to conceive with my sister. I have memories. I was 5 or 6 years old and they were going through fertility treatment, and they kept me involved. They explained what they were doing. I remember doing the alcohol swabs before my mom's injections. I remember them showing me pictures of a fetus developing, and so I think just that early exposure and interest just stuck with me all the way through. So for me, it's been a straight path since then. There was no question that this is where I wanted to be. It took a while to be able to grow our family. My wife went through treatment first. She did 2 IUI cycles that failed before we moved on to IVF, and that's how we got our son. And I had to go through 2 IVF cycles, multiple embryo transfers, and several losses before having our daughter. So I understand the roller coaster. I understand the dedication, both physically and emotionally, to get through the workup, the treatment, the failed cycles, coming back and having to start all over again. And I think understanding things from that side helps me to connect to patients much more. For me, at least, that's one of the special things that I love that I can offer to patients, is that I not only see things from the medical side, but I've been through it as a patient and a partner as well. Going through this process feels very lonely. Women and men typically don't talk about infertility. It's something that maybe they're embarrassed about or ashamed about, or just something that they don't want to draw attention to. People don't realize how common it is. They don't realize that the person sitting next to them in a waiting room, the person standing behind them in the grocery store, could be going through the same thing. I think it's important for everyone to realize that they're not going through this alone, that this is common, and that this is something that we can help you get through. And so the first thing I want my patients to know when they walk through the door is that I'm here with you every step of the way. I've been through it myself. So I know how scary it is. I understand how stressful it is. I understand the highest of highs and the lowest of lows as you go through it, but that I am there for every step.